Hi, I'm Dr. Ashish Dutta. I'm a cosmetic surgeon from Aesthetic Beauty Center. I'm going to talk a little bit about gynecomastia. By definition, gynecomastia is increased size of breast tissue in males. It could be just the breast tissue. Sometimes there is also a large collection of fat and excess skin. All three put together gives rise to gynecomastia. There are many reasons for it. It could be hormonal, it could be age-related, like there is an adolescent gynecomastia, and also that some of the people over the age of 40 or 50 develop slightly increased breast tissue, commonly known as man boobs and also known as moobs. There are mainly 4 grades of gynecomastia. The grade 1 is where there is a minimal amount of gland and fatty tissue, and usually they can be treated with liposuction or vasoliposuction alone. Grade 2 is where there is larger amount of fat and gland collection, where you may need to consider taking the gland out separately, because sometimes it is not so easy to remove the gland with liposuction or vasoliposuction alone. Grade 3 is where not only are we removing the fat and the gland, but also we may have to consider other measures to give the patient a better chest shape and size. And in grade 4, there is so much excess skin associated with the increased amount of fat and gland collection that we may need to consider a traditional lift, and sometimes we also undertake some skin excision to give it a better shape. When gynecomastia is related to age, particularly adolescent gynecomastia, which happens between the age of 12 to say 18 years of male patients, I usually do not do any of the hormonal baseline studies. But if gynecomastia has continued on into the early 20s and mid 20s, then we might have to undertake some hormonal tests to make sure that there is no other medical conditions that are involved. But by and large, for the grade 1 and the grade 2 gynecomastia, I would do vasoliposuction to remove the fat, and if there is any gland which is palpable or visible, then we may have to also excise the gland. In traditionally larger breasts, particularly in men over the age of 35 to 40, where particularly because of steroid use in their youth and many other medications that can cause gynecomastia, we may need to consider not only taking the fat and the gland out by liposuction and excision of the gland, but also undertaking a traditional mastopexy, which is the lifting of the breast along with skin excision to give it a better shape. The recovery for, of course, gynecomastia with mastopexy is longer, and it can actually change the person's life. When you can imagine, patients will say that they can't go on holidays, they can't take their clothes off, sometimes even in front of their partners, which is quite a compromising situation. And I think with gynecomastia simple procedures, we can make the patient's life better.